here is your question. Sorry. So if you have read and understood, considering 8 clinical examination station, kindly tell me, how would you
Yes.
examine? Yes, kindly examination.
Hello. I'm one of the exam candidates. May I confirm your name and age, please?
Yes, I'm Smith, 72 years old.
Yeah, I will wash my hands and then I will uh, say this patient that nice to meet you, Mrs. Smith. And today I have been asked you for the clinical examination of your legs. It will involve looking, feeling, and moving your legs. Are you okay with this?
Yes.
Okay, now can you please lie down on the bed for me? Uh, can you please remove your pants and keep your undergarments on, keeping the dignity
Okay.
in view of the patient?
Yes.
Yes, then I will first of all look for the hands. Can you please lay your hands in front of me?
Yes.
Now I will see his hands for any nail fall infarcts, then any nicotine staining, tendon xanthomas, and then I will ask the patient, can you please turn your hands towards the roof?
Yes.
Then I will feel for any sweating, and then I will feel for a capillary refill time, and then radial pulse. I will check. I will say the patient, can you please relax your hands? Now I'm going to look over your legs. I will check first of all by the sides of the patient. Is there if he has any moving aid will present by the sides of the bed, or anything else he is using. Then I will check first of all legs. On inspection, I will see for any uh, skin changes in the color of the skin, loss of hair, and any scar mark, any ulcers, or any venous guttering lip, lipodermatosclerosis. And I will also look out for the in between each toes, one by one, to look out for any ulcers, and as well as the pressure points like over the uh, heads of first and fifth metatarsal, and as well as the ankle, to look for any ulcers. Then I'm going to ask the patient, I'm going to feel for your legs. Do you have any pain in your legs?
And not now. You can examine.
Okay, then I will feel for it. First of all, I will check the temperature starting from below upwards from the foot, and then I will check with the back of my hand, check the temperature going upwards, and then I will feel that tenderness in the legs. I will mildly compress the legs, and I will see the patient's face if the patient is grimacing or not. Then I will then I will feel the pulses of the patient, starting from the femoral pulse. First of all, I will check with the normal limb, uh, considering that the femoral pulse is located in between the anterior superior leg spine and pubic symphysis. Then I will move down to the then I will move down to the popliteal pulse, and then I will move further down to posterior tibial as well as dorsalis pedis. Then I will compare each one pulse with the opposite limb, the ischemic limb, affected limb. And if I do not hear any dorsalis if I am not able to palpate dorsalis pedis or posterior tibial, then I will ask for the Doppler, uh, handheld Doppler, to see whether the pulse is uh, I was able to hear with the Doppler or not. Then I will also look for the uh, edema of the medial malleolus of the both the limbs, as well as pedal edema. And then I will auscultate for with the help of stethoscope over the femoral area, femoral bruise or an abdominal bruise. Then I'll ask the patient, I'm going to raise your legs. Do you have any pain in your hips?
No.
Okay, then I will raise the legs at about 40 to 45-degree angle to see whether the Berger angle is present or not. If the Berger angle is present, means the one of the leg has become white in color. And then I will ask the patient, can you please sit up for me? I'm going to release your legs by the side of the bed. Then I will notice down if the Berger test is positive or not. If there is a reactive hyperemia present in any of the legs or affected limb is present or not. Then I will then I will ask for the Doppler to measure for ankle brachial plexus, brachial index.
Indeed.
First of all, then I will measure with that handheld Doppler in the. I will cuff over the calf. Then I will inflate, keeping handheld Doppler in over the one pulse like dorsalis pedis, and then inflate above the systolic pressure till I'm not able to hear the pulse. And then I will slowly release the calf and I will watch, I will listen when the pulse has started appearing and I will note down the pressure in the lower limb. Then similarly, I will place that calf over the brachial artery and then I will inflate and then pulse. I will not able when the sounds was gone and slowly releasing the pressure from the calf and
Can
I will
you
place my Doppler.
can you please summarize your examination now?
Okay. Uh, uh, to complete my examination, I will complete my ankle brachial plexus index that I was not able to perform due to the lack of time. Today, I have done the examination of this 72 years old male. He is having positive nicotine staining on inspection. I have noticed there is positive nicotine staining present on the nail beds, as well as the patient is having altered color in right lower limb, and there is no uh, uh, ulcer present any of the legs, uh, but there are dampened sounds present in the over the damper impulse sounds present or monophasic sound present over the posterior tibial or dorsalis pedis in the right lower limb. Based on these findings, I'll consider my diagnosis as a ischemic limb post atherosclerotic or as well as or post hyperlipidemia, a diabetic. There is a peripheral vascular disease of the right lower limb.
Okay. Right. You've told me diagnosis. Kindly tell me what management would you offer to the patient?
First of all, I will offer the patient the conservative managements. I will ask the patient to reduce weight and stop smoking and lifestyle modifications like do regular exercises. And if the patient is diabetic, I will ask the patient to control diabetes with the help of anti-diabetic drugs. And lipid loading drugs can be added to reduce the hyperlipidemia. And then, as well as to control the blood pressure, giving the antihypertensive drugs. I can also add the blood thinners to this patient, like
Okay.
clopidogrel. These are the conservative managements. And in surgical management, we can offer the patient endovascular stenting, and there are other options like surgical bypass and angioplasty. And if the limb is critically ischemic, then amputation can be done in emergency.
How would you define the term critical ischemia?
Uh, uh, Based on the ankle brachial plexus index, if the value comes uh, below 0.5, then the patient is labeled, then it is a critical ischemic limb.
Good. How much should it be normal?
Normally, the level is 1.
Yes.
Normally, the brachial plexus index level is 1, and it is further categorized into 3 levels. If it is between 0.7 to 1, then it is considered it is a mild, or in the
Good.
patient would be having intermittent claudication in this range. And if it is between zero point 0.5 to zero point 0.7, then it is the patient might be having a rest pain during in this
Okay.
level. And if it is less than 0 0.5, it is considered as a critical ischemic limb.
How would you differentiate vascular ischemia from neurological condition?
In neurological conditions, there would be also there would be alteration in the reflexes. Uh, I will go with the first of all examination. I will do
Yes.
all talk cards. I will do this top tone. I will check tone, and then of the patient, reflexes of the patient, and then check the sensations of the patient of the limbs,
Yes.
and as well
Reflexes will
as
be delayed, and yes,
yes.
sensations will be altered. Very good. Okay. One last question. No, you've answered everything. Okay. If time would have allowed you, now Bell is gone. I'm just asking. If time would have allowed you, how would you have completed your examination?
I have how would I have completed my examination by completing the ankle brachial plexus index, ankle break. Then uh, yes, I will do the
Even there is no
abdominal
time.
examination. I will do
Okay.
abdominal examination and neurological examination of the lower
Yes.
limb,
Yes.
and
And
then vascular examination of the upper limb,
cardiovascular. Full
cardiovascular examination.
cardiovascular examination, and even the vascular examination of the upper limb and abdomen you've already said. For you'll also rule out aortic bruit, and you'll also
It,
auscultate for the renal,
yes,
yes, vessels as well. And one more thing that you would have done, you would have also checked the radial pulses to assess for the radiofemoral delay.
yes, I forgot.
Yes. Did you remember to check posterior tibial pulse?
Posterior table, yes, on the both the
Yes,
limbs.
good. That you did.
Posterior table and dorsal spinatus both.
Yes,
Is it?
good. Okay, good. Thank you. Yes, that was it.
It was right on time. That speed was fine.
Yes, we'll discuss that. It was good. It was right on time, except for the discussion that you did little slow.